Hello, friends! Thank you for joining me today. I want to talk with you about something really important. Something that affects millions of seniors across America, yet often goes unnoticed until it becomes serious. We're going to discuss 6 warning signs of diabetes that too many older adults overlook or brush aside as just part of getting older. But here's the thing. These signs are your body's way of asking for help. And when you know what to look for, you can take action early before things get harder to manage. Now, I know health topics can feel overwhelming sometimes, but I promise to keep this simple and clear. Think of me as a friend who cares about your well-being, sitting down with you over a cup of tea, sharing information that could truly make a difference in your life. So let's take our time and walk through this together. Before we dive into those warning signs, let me give you a little background. Diabetes is a condition where your body has trouble managing blood sugar levels. Think of blood sugar like fuel for your body. After you eat, your blood sugar goes up, and normally your body releases insulin to help move that sugar into your cells where it's needed. But with diabetes, this system doesn't work quite right. Either your body doesn't make enough insulin, or it can't use the insulin properly. When that happens, sugar builds up in your bloodstream instead of getting into your cells. Over time, this extra sugar in your blood can cause problems throughout your body. Now, here's why this matters, especially for seniors. As we age, our bodies change in ways that make diabetes more likely. Our cells can become less sensitive to insulin. We might become less active. We might carry a bit more weight than we used to. All of these things are perfectly normal parts of aging, but they do increase the risk. According to the American Diabetes Association, more than 1 in 4 adults over age 60 has diabetes. But here's the concerning part. Many people have it without even knowing. The signs can be subtle. They can seem like just another part of getting older. And that's exactly why we need to talk about this today. Because when diabetes goes unmanaged, it can lead to serious complications. We're talking about heart problems, vision loss, nerve damage, and kidney issues. But the good news, the really important news, is that catching it early makes all the difference. When you recognize the signs and work with your doctor, you can manage diabetes effectively and continue living a full, active life. Let's talk about the first warning sign. You might find yourself feeling thirsty more often than usual. Not just on a hot day or after exercise, but a persistent thirst that never quite seems satisfied. You drink water, but an hour later, you're thirsty again. Along with this, you're making more trips to the bathroom. Maybe you're getting up 2 or 3 times during the night when you used to sleep straight through. Or perhaps you're planning your errands around where the restrooms are located. Now, I know what you might be thinking. You might say to yourself, well, I'm drinking more water, so of course I'm using the bathroom more. Or maybe you figure it's just your bladder getting older. And yes, some changes in bathroom habits are normal as we age. But this pattern is different, and it's happening for a specific reason. When you have too much sugar in your blood, your kidneys work overtime trying to filter it out. To do this, they pull extra water from your tissues. This is why you feel thirsty. Your body is asking you to replace that water. Then your kidneys flush out the excess sugar through your urine, which is why you're making all those bathroom trips. It's like a cycle. High blood sugar leads to more urination, which makes you thirsty. So you drink more, which leads to more bathroom visits. Round and round it goes. Many seniors dismiss this sign. They think maybe they're just drinking too much coffee or tea, or they blame it on an aging bladder. But if you're experiencing both excessive thirst and frequent urination together, especially if it's been going on for a few weeks, this deserves a conversation with your doctor. Your body is trying to tell you something important, and the sooner you listen, the sooner you can get help. The second warning sign might actually seem like good news at first. You'll step on the scale and you've lost weight without really trying. Maybe 5 pounds? Maybe 10? You haven't changed your diet much, and you're not exercising more than usual. The weight just seems to be coming off. For many people, this feels like a pleasant surprise. We live in a world that often tells us losing weight is always good. But when weight loss happens without a clear reason, it's actually your body waving a red flag. Here's what's happening behind the scenes. Remember how I said that with diabetes? Sugar can't get into your cells properly? Well, your cells need that sugar for energy. It's like fuel for a car. Without it, your cells start looking for other sources of energy. So your body begins breaking down muscle and fat to use instead. You're eating normally, maybe even eating more because you feel hungry, but your body isn't getting the energy it needs from food. Instead, it's burning through your own tissue. This is why the weight comes off. And this is why it's concerning. Now, I want to be clear. Not everyone with diabetes loses weight. In fact, type 2 diabetes, which is the most common form in seniors, often comes along with weight gains. But when unexplained weight loss does happen, especially combined with other symptoms we're discussing today, it's a significant warning sign. The tricky part is that many seniors might attribute weight loss to other things. Perhaps you think your appetite has just changed with age. Maybe you figure you're moving around more. Or perhaps you've been under some stress lately. All of these things can affect weight. That's true. But when weight loss is happening without a clear explanation, and especially if it's accompanied by increased thirst or fatigue, it's time to check in with your healthcare provider. Your body is resourceful, and it will find ways to get energy. But when it has to break down your own muscle and fat to do it, that's not a path you want to continue down. Early detection means you can address this before you lose strength and vitality you need for daily life. Let's move on to warning sign number 3. And this is one that almost everyone brushes off. Feeling tired. Feeling worn out, even after a full night's sleep. Needing to sit down and rest more often than you used to. You might find yourself thinking, well, I'm getting older. Of course, I'm more tired. And yes, our energy levels do change as we age. But there's a difference between the normal tiredness that comes with aging and the deep, persistent fatigue that diabetes can cause. This fatigue has a specific cause. Your cells aren't getting the sugar they need for energy. Remember, even though there's plenty of sugar in your bloodstream, it can't get inside your cells where the work happens. It's like having a full tank of gas, but a clogged fuel line. The energy is there, but it can't be used. Beyond that, when your blood sugar levels are high, it can affect your circulation. Your heart has to work harder. Your blood becomes a bit thicker. This means less oxygen is getting to your tissues efficiently. All of this adds up to feeling exhausted, weak, and drained. Many seniors tell themselves this is just part of life now. They cut back on activities they used to enjoy. They stop making plans with friends because they're worried about having enough energy. They spend more time resting, thinking that's what their body needs. But here's the thing. While rest is important, this kind of fatigue doesn't get better with rest. You wake up tired. You go through your day feeling like you're pushing through fog. Simple tasks that used to be easy now feel like climbing a mountain. You might also notice that your muscles feel weak. Maybe carrying groceries feels harder than it should. Or perhaps you're having trouble getting up from a chair without using your arms to push. This weakness happens partly because your muscles aren't getting the energy they need, and partly because, as we discussed earlier, your body might be breaking down muscle tissue for fuel. If you're experiencing this kind of ongoing fatigue, please don't just accept it as your new normal. Yes, we all slow down as we age, but we shouldn't feel exhausted all the time. Your body is designed to have energy for the things you want to do. When that energy disappears without a clear reason, it's worth investigating. Talk to your doctor. Describe how you're feeling. Mention if this tiredness came on gradually or suddenly. Share how it's affecting your daily life. This information helps your doctor understand what might be going on and what tests might be helpful. Warning sign number 4. Involve your eyes. You might notice that your vision seems a bit blurry, especially when reading or trying to focus on details. Maybe you find yourself squinting more often or holding things farther away to see them clearly. Perhaps driving at night has become more challenging. Now, vision changes are common as we get older. Many seniors assume blurry vision just means they need new glasses. And sometimes that's exactly what it means. But when diabetes is causing vision problems, something different is happening. High blood sugar levels can cause the lens of your eye to swell. Think of the lens like a camera lens that focuses light. When it swells with extra fluid, it changes shape slightly. This changes how light enters your eye, making everything look fuzzy or out of focus. The concerning thing about this symptom is that it can come and go. Your vision might be blurry one day and clearer the next. This happens because your blood sugar levels go up and down throughout the day, especially if diabetes isn't being managed. When your blood sugar is high, the lens swells. When it drops, the swelling goes down a bit. Some people also notice dark spots or floaters in their vision. Others see flashes of light or have trouble seeing at night. These changes can be subtle at first. You might find yourself turning on extra lights when you read. Or maybe you've stopped doing needlework or other hobbies that require sharp vision, thinking your eyes just aren't what they used to be. Here's why this matters so much. Over time, uncontrolled diabetes can damage the tiny blood vessels in your retina. The retina is the part of your eye that senses light and sends signals to your brain so you can see. When those blood vessels are damaged, it can lead to serious vision problems, even blindness. This condition is called diabetic retinopathy, and it's one of the leading causes of vision loss in older adults. But here's the hopeful part. When diabetes is caught early and managed well, you can protect your vision. Regular eye exams become especially important. An eye doctor can spot early signs of diabetic retinopathy before you even notice symptoms. And with good blood sugar control, you can often prevent serious damage. So if your vision has been blurry, or if you're noticing any changes in how you see, don't wait for your next scheduled eye appointment. Call and get checked sooner. And make sure your eye doctor knows if you have other symptoms we've talked about today. This helps them look for specific signs of diabetes-related eye problems. Let's discuss warning sign number 5. Have you noticed that small cuts or scrapes seem to take forever to heal? Maybe you bumped your shin a few weeks ago, and that bruise is still there. Or perhaps you got a small cut on your finger, and it's been slow to close up and keeps looking a bit red. Along with this, you might be dealing with infections more often than you used to. Perhaps you've had several urinary tract infections in the past year. Or maybe you've noticed more skin infections, especially in the folds of your skin or around your nails. Some people develop frequent yeast infections or notice their gums are red, swollen, and bleed icily when brushing. These problems happen because high blood sugar affects your body's ability to heal and fight off germs. Let me explain how this works. When your blood sugar is elevated, it impacts your circulation. Blood carries oxygen and nutrients that your body needs to repair damaged tissue. When circulation is compromised, healing slows down. High blood sugar also affects your white blood cells. These are the cells that fight infection, like soldiers protecting your body from invaders. When blood sugar is high, these cells don't work as effectively. They can't move as quickly to the site of an infection, and they can't destroy bacteria and other germs as efficiently. At the same time, bacteria and fungi actually thrive in environments with high sugar. It's like giving them extra food to grow on. This is especially true for yeast infections, which is why people with unmanaged diabetes often struggle with recurring yeast infections in various parts of the body. Many seniors don't connect these dots. They think maybe their immune system is just getting weaker with age. Or they figure that slow healing is just what happens when you're older. And while it's true that healing does slow down somewhat as we age, the kind of persistent, problematic healing we're talking about here is different. Pay attention to your feet. Especially small sores or blisters on your feet that don't heal are a serious concern with diabetes. Because of reduced circulation and nerve damage that can happen with diabetes, you might not even feel a small injury on your foot. Then that small problem can become a big one if it gets infected and doesn't heal properly. If you're noticing that minor injuries stick around for weeks instead of days, or if you're dealing with infections more frequently than seems normal, bring this up with your doctor. These signs, combined with other symptoms we've discussed, paint a picture that your doctor needs to see. We've reached the 6th and final warning sign, and this one involves your nerves. You might feel tingling in your hands or feet, almost like pins and needles. Some people describe it as a burning sensation or a feeling like their feet are asleep. Others notice numbness, where parts of their feet or hands feel less sensitive to touch or temperature. This symptom often starts in the toes and gradually moves up the feet. Some people first notice it at night when they're trying to sleep. The tingling or burning sensation can be annoying enough to keep them awake. During the day, they might feel unsteady on their feet or have trouble with balance. This happens because high blood sugar over time can damage your nerves. This condition is called diabetic neuropathy. The nerves in your feet and hands are especially vulnerable because they read the farthest from your heart and spine. They're like the end of the line when it comes to getting nutrients and oxygen. When nerves are damaged, they don't work properly. They might send signals when they shouldn't, which creates that tingling or burning feeling. Or they might stop sending signals altogether, which causes numbness. Sometimes damaged nerves cause sharp, shooting pains. Other times, the sensation is more like a constant dull ache. Here's why this matters, beyond just being uncomfortable. When you lose sensation in your feet, you might not notice if you step on something sharp or if your shoes are rubbing and causing a blister. Remember what we talked about earlier with slow healing? When you combine reduced sensation with slow wound healing, you can see why this becomes a serious concern. Many seniors initially blame these sensations on poor circulation, arthritis, or just getting older. They might think it's from standing too long or from wearing tight shoes. And sometimes, those things do contribute. But when the tingling, numbness, or burning is persistent, especially if it's happening in both feet or both hands, it's often a sign of nerve damage that needs attention. The good news is that catching this early makes a big difference. When blood sugar is brought under control, nerve damage can often be slowed or even stopped. Some people find that their symptoms improve with good diabetes management, but nerves heal slowly. So the earlier you catch this, the better. If you're experiencing any strange sensations in your feet or hands, don't brush it off. Tell your doctor about it! Describe exactly what you're feeling when it happens and how long you've been noticing it. Even if it seems minor right now, it's information your doctor needs to have. Now, I know we've covered a lot of ground here, and if you're sitting there thinking that some of these warning signs sound familiar, you might be feeling a bit worried. That's understandable, but I want you to take a deep breath with me. This information isn't meant to scare you. It's meant to empower you. Knowledge is a gift. When you know what to look for, you can take action. And taking action early is one of the most important things you can do for your health. So what should you do if you recognize one or more of these warning signs? The first step is simple. Make an appointment with your doctor. You don't need to diagnose yourself. You don't need to be certain something is wrong. You just need to share what you've noticed and let your doctor guide you from there. When you talk to your doctor, be specific. Instead of saying you're just tired, describe how the fatigue affects your daily life. Mention when you first noticed the symptom and whether it's getting worse. If you've been tracking any of these symptoms, bring those notes with you. This information helps your doctor understand what's going on. Your doctor will likely want to run some blood tests. The most common is a fasting blood sugar test or an A1C test. These tests measure your blood sugar levels and give your doctor a clear picture of how your body is managing glucose. These tests are simple, quick, and they provide valuable information. If it turns out you do have diabetes, which is when your blood sugar is higher than normal, but not quite high enough to be called diabetes, remember this. These conditions are very manageable. Millions of people live full, active, happy lives while managing diabetes. With the right approach, you can too. Management usually involves a combination of things. Your doctor might recommend changes to your eating habits, not drastic dieting, but thoughtful choices about what and when you eat. Regular physical activity, even gentle activities like walking, can make a significant difference. Sometimes medication is needed, and that's perfectly okay. The goal is to find what works for you in partnership with your healthcare team. Even if you're not experiencing these warning signs right now, it's worth thinking about prevention. The choices we make each day can influence our risk of developing diabetes or help us manage it better if we already have it. Let's talk about food for a moment. You don't need to follow a complicated diet or give up all the foods you enjoy. But being mindful about your choices helps. Focus on whole foods when you can. Vegetables, fruits, whole grains, lean proteins. These foods provide nutrition without causing dramatic spikes in blood sugar. Think about portion sizes too. As we get older, we often need fewer calories than we did when we were younger. That's just part of how our metabolism changes. Eating appropriate amounts helps maintain a healthy weight, which reduces diabetes risk. Movement is medicine, as they say. You don't need to run marathons or spend hours at the gym. Even modest activity makes a difference. A daily walk around your neighborhood, some gentle stretching, gardening, dancing to your favorite music, all of these count. The key is consistency. Moving your body regularly helps your cells use insulin more effectively. Getting enough quality sleep matters more than many people realize. When we don't sleep well, it affects our blood sugar regulation and can increase diabetes risk. Try to maintain a regular sleep schedule. Create a peaceful bedtime routine. If you're having trouble sleeping, talk to your doctor about it. Managing stress is important too. Chronic stress affects blood sugar levels and overall health. Find ways to relax that work for you. Maybe that's spending time with loved ones, pursuing a hobby, practicing deep breathing, or simply sitting quietly with a cup of tea and a good book. Whatever helps you feel calm and peaceful is worth making time for. Stay connected with your healthcare team. Regular checkups aren't just for when something's wrong. They're opportunities to catch small problems before they become big ones. Don't skip appointments because you feel fine! Prevention is always easier than treatment. We've covered a lot today, and I'm so glad you stayed with me through this conversation. Let's recap those 6 warning signs one more time. Increased thirst and frequent urination. Unexplained weight loss. Persistent fatigue and weakness. Blurred vision. Slow healing cuts and frequent infections. And tingling or numbness in your hands and feet. Each of these signs is your body's way of communicating with you. Your body is wise. It knows when something isn't quite right, and it tries to tell you. The question is whether we're listening. I know that health concerns can feel overwhelming, especially as we get older and face new challenges. But please remember this. You are not alone in this journey. Millions of seniors navigate these same concerns every day. And with good information, supportive healthcare providers, and a willingness to pay attention to your body, you can maintain your health and vitality. Diabetes is not a life sentence. It's a condition that can be managed, often very successfully. The key is awareness and action. If you've recognized any of these warning signs in yourself, please don't wait. Reach out to your doctor. Have that conversation. Get checked. And even if everything checks out fine, you'll have peace of mind. You'll know you took your health seriously. You listened to your body. You advocated for yourself. That's something to feel proud of. Thank you for spending this time with me today. I hope this information has been helpful. Take care of yourself. Be gentle with yourself. And remember that every step you take toward understanding your health is a step in the right direction. Until next time, stay well, my friends.